Hi friends, good evening. I'm Dr. Ashutosh. Or doing this ultrasound to the fetus at something around 16 weeks. It looks very easy, and sometimes one small single finding can really change the complete paradigm, right? So we just saw one lady, and definitely the maternal habitus was the limiting factor. Because of the maternal obesity, it was slightly a limiting factor that probably we were not able to see the baby in a complete sort of an in one go, and meaning thereby that probably जैसे ऐसा होता है कि जैसे दिल भर के आपने बेबी को देख लिया, and then we are very happy, and then all of those whatever you wanted to see to the baby is being done in one go, right? So whenever it is there, so I always believe that the baby has got a tendency of a thief, राइट? बेबी की जो टेंडेंसी है वो थीफ की तरह होती है, तो अगर बेबी के पास कुछ है छुपाने के लिए, तो वो नहीं दिखाएगा. सो मीनिंग देयर बाय दैट इफ यू आर सीइंग, if you are standing at a tower and looking around for all the people moving around, so anybody who would be suspicious, he would not come around openly, meaning है ना. So similarly, on that pretext, we try to look around for that baby again, and one small finding really changed the complete sort of in situation, as a matter of fact. Okay, so let us get to the specifics about it. So as you can see, this is the hand. Okay, so इस तरह से ये उंगलियां होती हैं, and usually the baby keeps the hand like this, and so meaning thereby that usually it is in a flexed position. Usually this is the neutral position of the hand. Okay, so the baby keeps it like this. So whether we see, so probably we try to wish that we wish that the baby is moving around so that we can see the fingers from absolutely every angle. So once we saw after a sort of a second time and great effort, what happened is that the baby has kept both the hands across the behind the back, and then only we were able to pick up that small finding. And then finding was like this. Okay, so the hand was like this. So probably we were having the syndactyly of third, fourth, fifth digit, and this was the complete position. And this was true with both the hands. So let us first see this images, and then probably we'll talk about the whole scenario. तो इसको ध्यान से देखें तो आपको ऐसा समझ में आता है कि ये सिंडेक्टाइली है 3 4 5 डिजिट्स की. सो दिस इज द इंडेक्स फिंगर, और इन दोनों के बीच में देर इज अ डिफरेंस. So we try to move around with the baby, and then the baby was not showing us any sort of a movement between 3 and 4 5 digits. ये दूसरा हाथ है. मतलब similarly in the same lines, अंगूठा दिखा, index finger दिखी, and index और third 4 5 digits, they are in unshan, meaning thereby that it is a bilateral syndactyly between 3 4 5 digits, right? So bilaterally it is a syndactyly between 3 4 5 digits, and then they are moving in unshan. Whenever we believe that the advanced age either of the parents is there, so probably we can have different set of congenital abnormality to the baby. So advanced maternal age, whenever we believe that the age of the mother is greater than 35 years, now we believe that it is 38 years. So advanced maternal age, there is a high risk for aneuploidy, for Down syndrome, as well as for microdeletions. Vis-a-vis, if it is an advanced paternal age, there could be high risk for an autosomal dominant conditions, and mostly they are skeletal dysplasias. Like we can have achondroplasias, we can have thanatophoric dysplasias. Similarly, we can have those syndromes in which the craniosynostosis element is more pronounced, meaning thereby कि हमारा जो ब्रेन होता है, हमारा जो क्रेनियम होता है, जो स्कल होती है, वो 6 बोन से बनती है, और देयर इज अ प्री मैच्योर फ्यूजन ऑफ दोज सूचर्स, एंड देयरफॉर इट इज कॉल्ड एज अ क्रेनियोसिनोस्टोसिस, राइट? तो उन्हीं क्रेनियोसिनोस्टोसिस के एलिमेंट में हमको सिंडेक्टाइली मिल सकती है. लाइक कारपेंटर सिंड्रोम है, तो कारपेंटर सिंड्रोम में भी कार्डियक डिफेक्ट होती है, थोड़ी सी ओबेसिटी का एलिमेंट होता है. Then we can have an Apert syndrome. Apert syndrome is one of the commonest craniosynostosis syndromes, and therefore it is called as an acrocephalopolysyndactyly types. एंड वी कैन हैव ए फीफर. तो फीफर में यूजुअली जो थम्स हैं या टोज है वो थोड़े से ब्रॉड होते हैं, और हम यूजुअली स्मिथ लेमली ओपीड्स या कुछ और कंजेनिटल क्रोमोसोमल एबनॉर्मिटीज और जेनेटिक एबनॉर्मिटीज में भी मिल सकता है. बट प्रॉब्ली वेन एवर वी आर सीइंग, तो एपर्ट सिंड्रोम में थोड़ा सा टिपिकल मिटन हैंड टाइप्स हो जाती हैं और ये सब बातें हैं. बट प्रोबेबली दिस बेसिक premise of identifying this syndactyly raised our tentacles, and therefore we have so meaning thereby that the bone window was there, face was all normal. We didn't identify the craniosynostosis at the moment. This is what we are doing at 16 weeks and 4 days. So eventually, whenever we are identifying some abnormality, and therefore we've asked her to come back again after few days or so, so that the baby grows in the meantime, and then probably we are able to concord the findings that we are seeing at 16 weeks and 4 days. And we intend to do the amniocentesis so as to look around with the comprehensive genetic analysis to the baby so as to identify what sort of an uh, zygosyndactyly भी हो सकती है, meaning thereby that this could be a normal thing, and therefore we are having a syndactyly bilateral in both the hands, and therefore if we are able to rule it out that probably it is not genetically, if it is not a fever or carpenter or Neper syndrome, then we are happy about, right? So identification of the syndactyly in both the hands really raise the tentacles, and therefore from a normal sort of an getting a normal ultrasound, we are now getting into an domain of an craniosynostosis, apert, carpenters, and fevers in the decreasing sort of an frequency and likelihood, right? Thank you very much for your patience.